Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, today's show, two big policy subjects: universal health care will come to our country, and then roads and bridges. Have you been on these highways lately? That and more following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, and welcome back to the program. Well, President-elect Barack Obama, one of his major domestic policy agendas, the delivery of universal health care coverage to Americans. In the Senate, as we sit here and speak with you today, plans are moving to pass legislation that will accomplish that. Joining me, as often is the case, is Dr. Stuart Shapiro. He is president of the Pennsylvania Healthcare Association. Doctor, welcome. Well, look, we've had a number of discussions over the years about universal health care. Barack Obama has made it one of his top priorities. It's a huge issue, given the fact we have this financial meltdown going on in the stock market and all that's going on. Where do you see universal health care going right now?
Well, first, it's an issue I've been working on since 1973.
Nothing new to you, right?
It's nothing new, nor are the battles that are coming up ahead. And it is not going to be a slam dunk this year, despite the fact that President-elect Obama made it a major campaign issue. Health care reform is a soft issue among Americans. And I've got some polling data which I could share with you. But the Congress was 57 Democrat senators when Bill Clinton was elected in 1992. We have 57, 58 Democrat senators today in the Senate going into next year. It is not going to be easy. The Senate is not filibuster-proof. The public has lukewarm support of overwhelming universal health care, and we're in an economic meltdown. I wish we could get it quickly. I wish I could sit here and say it's going to happen by the middle of 2009, but I'm not that optimistic.
Yeah. I mean, I think you're right about your assessment about the intensity level. I mean, there's still a huge number of Americans who do have coverage through their employer. In fact, in our state, and we'll come to that, our state in the next segment, something like 93% of Pennsylvanians have health care coverage. Do you think that's in part the problem, that so many still do have it and there's a much smaller percentage who do not, so therefore those who have aren't as intensely interested? Is that
well, I think that's part of it, and thank God that we only have, and I use say only, 47 million Americans who don't have health insurance. But the fact is that when people are polled across all segments of the population, last spring, in February, March of 2008, 35% of Americans said that health care was a serious problem in America. Yeah. Gas prices went up. That replaced health care as a major issue, with the economy and Iraq always above that. Now that number went from 35 this summer to 22, is at 12% today.
Yeah. But one of the things that's kind of fascinating is whenever questions get asked about the economy and the fact that folks could lose their jobs, that if they lose their job, they lose their health care. And in addition to that, more employers, and we do have a lot of small business folks on this show, and they want to provide a coverage, but sometimes they just can't, and so they do co-pays and deductibles, or now give people a flat bit of money and say, here's whatever they're going to give them, $100 or $200 a month, you go buy your own health care. So that, in a sense, may also assist the folks who want universal coverage in their pursuit of that goal.
Well, I think that in some way or another, both the insured and the uninsured would like to see health insurance, but the economic costs are staggering.
Right.
And it's going to require an investment of hundreds of billions of dollars, which will ultimately save money over the after 4 or 5 years. I mean, back in 1973, we were spending 7% of GDP on health care. Today, we're at 15%. And those numbers are unsustainable, And what we're going to need to do is put an overall cap on health care spending and then spread it across everybody.
So your point is that you think we need to reap more efficiencies out of the system at the same time we try to provide for additional coverage.
We have to build on the system we have. Every country who's ever had national health insurance builds on the past system. But we do need to use information technology. We do need a more efficient system. And we have to have an overall cap on spending. Without that, the cost will go up like this, and we won't be able to afford it.
Yeah, and we've not even yet touched the reforms. One of the disappointing things for me personally in the course of the campaign, presidential campaign, was that we had no real discussion of Medicare and Medicaid. I mean, these are two giant programs for which the eligibility will grow and grow as the baby boomers already in the process of signing up for Medicare, and then, you know, obviously as with the economy, more folks will slip into the poverty level to be eligible for Medicaid.
Absolutely, and you're hitting on the other big issue. We talk about health insurance for the 47 million uninsured. On the other hand, America, including President-elect Obama, have not talked about how are we going to meet the health care needs of the 80 million baby boomers who are now turning 65. Medicare doesn't, Medicaid doesn't, and Social Security doesn't. So it's going to be a real problem.
All right, we're talking with Dr. Stuart Shapiro. We're chatting about universal health care. It's a big agenda item for Barack Obama, the potential problems of getting it passed. How about our own state? Governor Rendell has his own plan. We'll talk about that and more following these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. State health care coverage. Governor Rendell has tried now. He's been trying for a long time to cover the 800,000 Pennsylvanians. He's ratcheted that down to where the last time he was down to covering 230,000 of them. Where does all that stand at the moment?
Governor's right in wanting to have everyone in Pennsylvania have health insurance. But he can't solve this problem alone, which is why the federal government is looking at it. But we have real health care problems in the state. And not only is it just the health care, it's the long-term health care needs. And this year, I don't think we're going to see any action on health care reform. And I don't know what we're going to do coming when the legislature comes back January 1st or in January. We've got a budget deficit that was, as of 2 weeks ago, $500 million. Yesterday, the governor, or earlier in the week, the governor said we got another $300 million of spending cuts that are necessary. And we're likely to have a deficit in Pennsylvania of $1 to $2 billion.
Oh, it could even be higher.
And therefore, the message that I think all citizens ought to be telling their legislators, and they ought to be writing the governor is, take care of those in Pennsylvania who are the frailest, who are the elderly. Meet those obligations first. Make sure those people get quality care, whether they're at home or whether they're in a nursing home. But make sure that they get good care before you start adding new programs.
So your point would be that given the state of the economy and the deficit, you think it's going to be difficult to move into coverage of additional Pennsylvanians, given this, at least immediately. And the legislature, by the way, has shown no inclination, particularly the state Senate, to do this, correct?
Well, I think you limp along where you are. As bad as the situation is, I mean, the people without health insurance do get health care. Inefficiently, because they go to emergency rooms, but they get health care. We have 80,000 people in nursing homes who need care, 50,000 of them under Medicaid. You can't cut back those programs, just like you can't cut back the programs for the elderly at home. It's very important. Before you can't rob Peter to pay Paul anymore. We're in too tough of an economy in Pennsylvania.
Yeah, on another subject, and I know you and I haven't talked about it. Look, given you're a physician, are you concerned that in this environment now that we have these critical needs for doctors in certain parts of the state, in the nursing homes, I mean, you having folks, particularly in the more rural areas, having trouble getting physicians to come and work and to help out your patients?
There's shortages of all kinds of healthcare people, whether it be physicians in certain areas, nurses' aides, nurse assistants, licensed practical nurses, registered nurses. We're heading down a real shortage in our workforce as people are getting older.
Right.
And we have to address that issue. The governor has held hostage, and he has said this publicly, the M-Care legislation, which provides a mechanism to help doctors pay for very expensive health insurance. Not health insurance, malpractice insurance.
Malpractice, right.
That ought to get passed, if not this session, very early in January. We shouldn't be playing chicken over issues of making sure that the healthcare workforce is effective and stays here in Pennsylvania. And that's what's happened this entire year. That bill could have passed the legislature, and it was held up trying to get health care for the uninsured.
But in general, I mean, it looks like across a whole range of sort of issues that affect health care, we've got some very serious problems that the economy certainly isn't going to help, but you know, we often focus on the more immediate needs, but looking long term with these 75 million people who are going to end up being on Medicare, and many of them on Medicaid eventually, we're looking down the road at a systemic problem that the policymakers haven't even begun to kind of get their hands around.
And they can't do that in Pennsylvania. The Pennsylvania piece is a small piece of it.
Yeah.
The policymakers who are looking at health insurance also need to look at fundamental reform of Medicare, Medicaid, Social Security.
And you're talking about at the national level
Absolutely,
now.
At the national level. And that piece is probably more expensive in the long term than national or universal health insurance.
Well, I'll tell you what. Well, we'll continue to bring updates on this. I want to thank you for coming in. We'll see. We got the new session coming up in about 6 weeks or so. This deficit, I think, is going to dominate, and I think you would agree. Balance the budget. The big T word gets mentioned. You know, do we have taxes or don't? But health care normally would be center stage. I think you would agree if we didn't have this problem right now with the economy.
It will be center stage, but we do have a problem with the economy, and therefore, while the discussions will go on in the center of the stage, will anything be done? And that's the challenge.
All right, roads and bridges, what can be done about them? We're talking about 2 important problems today. Little repair jobs, a little different kind. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. We're going to turn away from health care to roads and bridges, something we've talked about. Joining me is Jamie Van Buren. He's COO of New Enterprise Stone and Lime, which is a family-owned, privately held highway construction firm. I got that all out. But look, you're in the trenches. We talk often to a lot of policy guys, but you actually have to build these roads that we hope to use. I mean, look, we've got a large number of roads in this state. Everyone admits a big study by the state of Pennsylvania about now maybe almost 3 years ago said we need $1.7 billion a year. The state cannot survive economically without having good infrastructure, and it's got to start with roads and bridges. I don't know. I almost don't know where to start.
Yeah.
You're in the trenches. What's your sense about this?
We need to do something comprehensive.
Yeah.
Where we've started with this, with Act 44 and some of the other things that we've tried to do to create the funding stream so that we can make the investments in the infrastructure, we've started with sort of a piecemeal approach. And I think when we do that, the public looks at it and says, well, I-80 tolling, for instance. You're going to polarize a group along I-80 against the rest of the Commonwealth.
And that's what happened.
And that's exactly what happened. And so there are a lot of things in conjunction with that can and should be done. And so we've started the debate on where do we come up with the funding to make the investment.
Well, that's great. What's your, you're on these roads. You're building them and repairing them.
Yeah.
What is your sense about where we really stand? On a scale, how critical are these needs?
From an infrastructure standpoint, there are clearly bridges out there. Some of them are 9s and 10s in that they need to be fixed. Some of them are 2s and 3s. But from a congestion mitigation standpoint, we have to be fixing those things and at the same time working to reduce congestion, which means we need to be working on new arterial feeds. We need to be doing some creative things around our urban areas, maybe stacking highways on top of each other. That all requires investment. And the current infrastructure, a lot of it was built 30, 40, 50 years ago.
Yeah, we know. We get out in the roads and
it's like the human body. When the human body
Yeah.
becomes 40, 50, 60 years old, it needs attention. And
like
I'm tying it back into the health care here.
I know, that's right. We go to health care.
Yeah, if you're not paying attention to the infrastructure of a bridge or a road, eventually it deteriorates. We didn't build these things forever. We as a society didn't overspend on the original construction, and so they had design lives. And a bridge with a 50-year design life needs to be...
It has 50 years.
It has 50 years, and when we stretch it to 60 or 70, then you wind up with the Birmingham Bridge in Pittsburgh that falls, the bridge over I-70 about 4 or 5 years ago that literally collapsed onto I-70, and we didn't have any problems there. No one got hurt, but... That's where we are with the state of our current infrastructure.
Well, we're going to go to a break. When we come back, I want to talk about what you think the state ought to be doing. I think we've identified the problem now, and I think there's a consensus. What's fascinating to me is Republicans and Democrats in the state agree that we have this problem. The House and the Senate agrees, and the governor agrees. Yet we've tried one thing, tolling Route 80, Act 44. It didn't work. So we've got to figure out how to do this, and we know you have some ideas about that. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. We're fixing things today. We're trying to fix the healthcare system, and we're trying to fix the roads and bridges with Jamie Van Buren. All right, you all went to the Senate recently, and state Senate, and you said, okay, here's what we ought to do. So give us your 4 or 5 things you want done. Or how do we pay for this?
Well, I hate to say spread the pain, but you need to be comprehensive, and when you just attach one constituency, then surely you're kind of setting yourself up for failure. So we believe that you do have to toll the interstates, but not a interstate. You have to look at all the interstates, and you have to put up a fair number so that nobody is unduly burdened. We think that we need to raise the gasoline tax a little bit. Not as much as if it was the only thing we're doing, but we're spreading it around.
It gets down below $2 a gallon. It sounds like a better deal.
I thought they'd stored all the ones. It's $1.99.
I got it.
we need to move the cap on the oil company franchise tax up a little bit. Again, it's not the only thing we're doing, so we don't have to move it a lot.
Right.
Public-private partnerships got lost in the whole turnpike deal of leasing or selling the turnpike, but they're good, and there's places in the country where they're being used to fund new projects, for instance, and they don't have to be $5 billion projects. You can do a $500,000 project with these. We need to start shifting the responsibility back maybe to the general fund on the state police. There is a balance there, but when 76% of the state police are funded out of the motor license fund, that really is an imbalance in how that's being paid for. And all of those are short-term, intermediate-term. The long-term fix here, as we see it, is we need to start studying some type of mileage-based fee arrangement, user fee arrangement. Right. The technology is certainly on our side as this plays out, and you can classify weights against what the mileage fee is, so that somebody that's driving a small, lightweight car in an uncongested area is paying a different amount compared to someone driving a heavy SUV in a congested area.
Sure.
And the technology is there. We just have to study how to most appropriately do it. And then you're moving away from fuel tax, gasoline consumption tax, with the way our society's going, with more fuel-efficient cars, with the use of ethanol and some other different types of fuels. That tax becomes less and less available.
Now one of the things, I mean, if I understand the original report from the task force the governor set up was $1.7 billion a year for a long time, let's say 10 years. Every plan that they've come up with didn't come anywhere near that. I mean, even the tolling Route 80 was something like 850 or 900 million, if I'm right about that. Divided, between mass transit. We didn't even talk about that. You're only talking about another piece of it. So do any of these plans get us near? I mean, doing all of this more comprehensive.
All of that stuff is 1.7 to 1.9 billion dollars, and it's little bits and pieces all added up, and you wind up with something that looks like a solution. And all
right, great update. I mean, this is a subject we've covered on this program before. We've had legislators, even Governor Rendell's come on. We chatted about it. We're going to do more on this. This is an important subject. Hey, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.